Spinal stenosis is kind of the end result of what is a natural process of the spine. So the spine ages in a somewhat kind of predictable way. And so I've got a patient in the room, I've got a spine model, and I'll show them like the spine is made up of these bones, and in between the bones there are discs. And so over time, those discs will start to kind of settle down, and then the bones will have, bone spur would be a term that I would use. And so as all that happens, it starts to accumulate and it'll start to narrow the pathway for for the nerves that are in the back to travel. And that narrowing is called spinal stenosis. And so it's kind of, I call it a disease of aging because it gets more common as people get older. And so as the spine starts to degenerate and results in spinal stenosis, the severity or degree of stenosis will dictate usually how bad the symptoms are. And that's from a pain standpoint. But a lot of times it's not necessarily the pain, it's really that the people become much less functional than they were before. And that's what they've really noticed is I can only walk a few blocks before I have to sit down. I've noticed that if I get into Walmart, I better find something a grocery cart or something like that to bend forward. Or I can just only stand for a few minutes to make a meal or get ready in the morning type of thing. So those are some of the ways that it'll start to show up and why patients will seek treatment. They'll range from the most conservative thing is some type of activity modification. So you just kind of learn to kind of live with it. You just adapt. Either you add a walker to your routine, or you grab the grocery cart, or you go sit periodically. And people, as I've talked to patients, they really do that for a long period of time. By the time they come to us, it's because it has reached a threshold where they are ready to do something else. Up from them figuring out on their own or kind of living with it, physical therapy can be helpful. And so physical therapy is designed to kind of change how the muscles engage with the back and the pelvis. And some of it's instruction on how to teach people how to kind of manage these the symptoms and the limitations related to it. Up from that gets into sometimes medications can be helpful if it's in short bouts. I have pain for certain episodes, or I'm going on a trip or some type of activity. After that, injections. So injections can help manage it for some amount of time. There have been some emerging treatments. So there's a little device that can go in between the spine and try to open that space up or try to keep it open. So when you stand up straight, that's what happens is the spine narrows when we're standing up. And so this little device called a Vertiflex or interspinous spacer keeps that particular segment open when you stand up. So it keeps it from getting pinched. And so that is something that I've used successfully to help patients with their pain or their functional status. If none of that works, or it is just severe and beyond any type of minimally invasive or less invasive approach, then surgery would be where that would head. And so that would be a lumbar decompression.